Good morning, this is Dr. Tyler Hamel, chiropractor and nutritionist in Kingwood today, talking about a commitment to get better. I always tell patients, when new patients come in, I say I only work with those patients who I truly believe that I can help or I can help get better, right? Because if I didn't think I could help them, why would I want to see the patients, right? My job is to help them if I can. If I can't help them, send them to somebody who I think can help them. So that's number one. Number two, I only work with patients who will participate in their recovery process. So again, with new patients, chiropractic treatment and adjustments are great. There is nothing like it to release pressure in the spine and the neck and the mid-back, the low back, to help with things like neck pain, back pain, headaches. There is nothing like that. You can't do that on your own. You wouldn't want to do it on your own. There isn't any other therapy that's like chiropractic, which is awesome, right? You can come in here, get the therapy that you need, and go on with corrective exercises. So participating in your recovery process, that means doing the things to help your body recover better. So for us, corrective exercises, I always show patients how to do postural corrective exercises to help with their condition, right? Exercises to help them improve their posture, right? Because improving posture is going to take pressure off the spine, and it's going to help with things like neck pain, back pain, sciatica, and headaches. So it's really, really important that the patient participate. If there's no participation, it's really tough for the patient to get better. Other things we do are recommendation of natural supplements to help with healing and repair and pain relief, inflammation relief. That's also a key thing, right? So think about chiropractic. When you're going to a chiropractor, the adjustment and the treatment, it's awesome. It's fantastic. There's nothing like it. But the participation on your side or your end as a patient makes the whole difference. And this is what is very different from mainstream medicine, right? If you have a pain or you have some kind of condition, oftentimes you'll go to the medical doctor and get a medicine to take. And they'll say, well, just take this medicine and see how you do after the next couple of weeks or a month. So your participation in that is only taking the medicine. That's all it is. So that's easy, right? And that's why I think a lot of people get used to that medical model. It's like, I have a condition, I take a pill. I have a pain or inflammation, I take a pill. I have heartburn, I take a pill. I have high blood pressure, I take a pill. High cholesterol, I take a pill, right? But that's only a small percentage of participation that you're capable of, right? For heart, any kind of blood pressure, for reflux, for pain, inflammation, there's lots of other things that you can do besides just taking a pill, right? Some of the other things, you can use ice packs when you're at home. Make sure you're getting enough sleep. That's a huge thing. I just did a video on recovery, healing, and repair. If you're not sleeping well, you are not healing and repairing effectively. Some people haven't been doing that for years, right? So if you have chronic pain, chronic aches and pains that aren't going away and you're not sleeping, that could be part of it. Eating more healthy, that's another big thing. Drinking lots of water, staying hydrated enough. Simple little things like that can make a huge difference. That's what I mean by participation. It's way more than just, say for us, chiropractic, just coming in, getting your treatment, and you leave. It's much, much more than that. And those folks or those patients who participate in doing the corrective exercises multiple times a day, taking natural supplements multiple times a day, getting good sleep, staying hydrated, those patients always get better quicker. And who doesn't want to do that these days, right? Better quicker, that's a good thing. But there's only so fast that you can get better. If you've had headaches or back pain or neck pain for a year or 6 months, it still takes a little bit of time, but you can improve or shorten that time by participating and doing the things that you need to do. So think about that. If you have some kind of a treatment plan with chiropractic or physical therapy or acupuncture, and you're ideally supposed to come in twice a week or 3 times a week, but as a patient, you decide, well, maybe I'll just come in once a week and see how it goes for a couple weeks, right? That never works out very well. What if you went to the orthodontist and they were going to put braces on you or your son, and you think, well, I know for braces, it takes 1.5 to 2 years. It's a process. You have to get them on, you have to tighten them, so on and so forth. But you talk to the orthodontist and say, well, let me see if, why don't we try 3 months worth of braces and see what happens after that, right? So that's never going to happen. It's never going to fly. The orthodontist would never entertain that thought. So think about that as the same with say high blood pressure. You go to the cardiologist, they say, Mrs. Smith, it is imperative that you stop eating this or drinking this, and you have to start taking this medicine because of that. And if you're thinking, well, I'm just going to take that medicine when I'm kind of feeling bad, then maybe that'll be good enough. But no, right? There's recommendations for a reason. So you would always listen, say, to your dentist or your cardiologist or your primary care physician. Always listen to their recommendations, right? If you follow the recommendations, odds are that you're going to feel better and get better. So the same with chiropractic. There's no magical way to treat somebody who's had headaches for 10 years and get them better in 1 week, or their neck pain or sciatica. They can start feeling better in a week's time, but to actually get them better, correct and fix the problem, it takes a little bit of time. So just remember that. Dr. Tyler Hamel today talking about commitment to your care. The more committed patients are, the more they follow their treatment plans, the more they participate in their own health. It makes sense. But the more they participate, the better they get, the quicker they get to feeling better, meaning less pain, more movement, more productive at work, able to play with their kids, able to go to the gym and do different things like that. So again, Dr. Tyler Hamel talking about commitment. Any comments about commitment or chiropractic or aches and pains, put it in the chat below. I'll do my best to answer that. I'd love to help people just understand chiropractic and health and wellness better. I've been doing it for 21 years. Use my knowledge. You can ask me anything. Again, Dr. Tyler Hamel, Kingwood chiropractor and nutritionist. You guys have a great day.